students need to really be thinking hard in the classroom. They need to be working harder than you're working. And so when you have students whose brains hurt, that means they're using their brain power in a way in which they're thinking deeply. So when we get done with this class today, your brain should hurt, because if your brain doesn't hurt, then I haven't done my job.
Clinical judgment, real-world decision-making. These aren't just skills, they're the essence of nursing. Discover how active learning transforms students from passive learners into confident, capable nurses ready for the challenges ahead. Welcome to the Lippincott Spark, Illuminating Nursing Education podcast. I'm Dr. Kelly Drees. Join us as we ignite your passion for nursing education and leadership. We'll explore the latest trends, hear from expert nurses, and provide tools to keep you inspired. Let's dive into today's episode and continue your professional development journey together. Welcome. Today we're continuing our series on active learning, this time from a student's perspective. Active learning isn't just a teaching strategy, it's a student experience. It keeps learners engaged, builds clinical judgment, and helps them grow into the role of the nurse. In today's episode, we'll explore what makes today's learners thrive in an active classroom, how to motivate disengaged students, and why active learning is a catalyst for clinical judgment. Our guest today is the inspiring Karin Sherrill. I'm so excited to talk to her again, a nationally recognized nurse educator, curriculum consultant, test item writing guru, and advocate for student-centered learning. With a background in simulation, faculty development, and instructional design, Karin brings a unique lens to how active learning transforms the student experience. Hello, Karin. Welcome back.
Hi, Kelly. Thank you for having me.
So, as I was thinking about this episode, active learning is more than just a buzzword. It's really a shift on how we connect with those diverse learners. And I would love to explore ways how it draws students into that active classroom, how that peer interaction fuels engagement, and how these strategies help students not just study nursing, but truly become nurses. So, all right, what makes today's diverse learners open to an active classroom? And what do you see as the benefits that students kind of report when they're learning in that active environment?
You know, it's interesting as you were asking that question, the word diverse learner was kind of resonating in my mind. And of course, I think we have a stereotypical idea of what a diverse learner is, but the reality is that every single student sitting in our classroom is diverse. It's not a unique population that is the diverse learner. And I think oftentimes we categorize people into diversity. But the reality is every single student is diverse. And we recognize that our learners are multimodal. We recognize they're tech savvy. Not all of them, but majority of them are. We know that the environment they're currently living and learning in is Instagram Insights, where they're on an Instagram site and in a minute, 2 minutes, they're getting all the information they need to base an opinion and to form their life. So what is it that we can do in an active classroom in a short, impressionable amount of time that is really going to morph them into being an exceptional nurse? And that's the beauty of active learning, is that we are now meeting the students where they're at versus expecting these students to come to where we are at, which is what happens in a traditional classroom. And that's not the comfort of the diversity in our classroom in this day and age.
The students have such, and you touched on this, the multidimensional factors that impact their ability to persist, whether they're academic or non-academic, and they may learn differently, and to be able to meet them where they're at is so very important. So when we look at the role of peers, their peers sitting next to them, what role do they have as they interact, and what role do they play in student engagement during that active learning?
So when you look at who's sitting next to them, and you have different types of students in your classroom, you might have one student that is very introverted and doesn't have a lot of friends and colleagues that they have bonded to in the classroom and they really keep to themselves. Well, it's important for that person to benefit from a peer in order to help get them out of their shell, to expand their communication skills, to work with someone who maybe is not comfortable to work with. Versus maybe you'll have 2 or 3 students that are joined at the hip. These students go to the bathroom together and everything they do is together. Well, oftentimes, if you have 2 or 3 or 4 students that are so tightly bonded, that study together, that read together, that raise their children together, whatever it is they're doing, the problem with that is that they often are carrying each other. So that when you pull one person out of that group, they no longer have the ability to be successful independently. So the benefit of the peers is the fact that we're creating teamwork and collaboration. We are within that classroom and we're supporting the tools that they need to be a successful nurse to work on a team that is different from them. And so one of the things that I think is critically important in any classroom, active or not, is to make sure that we're shaking the students up. So I don't want you to continually be working with the same student that you're studying with, who's your study buddy and your testing partner, whatever. I want you to meet up with this person over here who you've never had a conversation with. And you need to figure out how to get along and work together cohesively in caring for this active, engaging patient that we're caring for in the classroom today. You need to figure out how to do that together as part of the team.
That's what they're going to see when they get into practice. Absolutely. How does active learning help students become the nurse rather than just learn about nursing?
The way that you structure the classroom, the types of activities that you choose to engage students in have to be very much clinically focused and clinically based. So, some of my favorite activities that I use repetitively at different points in the semester, one of my favorites is an unfolding case study. And an unfolding case study is one where you don't have all the information right up front. You don't tell the students, this is their name, this is their age, this is their background, this is their lab reports, their vital signs. You don't give them all that information. Because as a nurse, when that patient comes to me, I have to gather all that information. It's not just right there for me. So walking students through this, what I love to follow is the steps of the clinical judgment measurement model. So the students are recognizing cues, but watching this patient unfold is so critically important to engaging that clinical judgment thinking model of having students create this patient as it unfolds in front of them. I also love activities where I'm introducing students to a patient by giving them an SBAR report in first person. I am the nurse. I'm giving you a report today. And I may do that live or I may do that with an audio recording. Either way, students are hearing, I'm like, okay, everybody pull out your paper and pencil. Your shift is beginning. Here's the patient you're going to care for today. So you're role playing a proper SBAR handoff shift report. And students are trying to gather that information very quickly because I talk at the same pace as that nurse does at the bedside, and allow them to formulate that patient scenario or using an activity so that maybe I'm becoming the patient. I love to keep a hospital gown up at the front of the room. So we're going to be talking about a patient maybe with an MI, and I put this hospital gown on over my clothes and I become that patient. And students have to start asking me questions where I just am moaning and grabbing my left arm because it hurts and it aches, and they have to start inquiring what's going on. How long have you felt this pain? Are you having any other symptoms? I have the classroom take on first person role as if I am the patient that they're caring for. So those types of interactive, engaging activities, I think really can make a difference in students to get on top of it because they're taking care of a patient right here in the class today. It's not like they're learning about how to take care of a patient. They're actually doing it.
It's clear that active learning can really spark that deeper engagement. But I always think about the times then when that spark doesn't really catch. They're not really getting it. They're not really engaged. So let's shift our focus to motivation and how nurse educators can support every student, especially those who may be a little bit hesitant to dive in. So what do we do with students who won't engage? How can they be motivated?
I think the first step is to make sure that you set down your expectations right from the start and let students know. I'd mentioned this in the previous podcast. From the very first day of class, they need to know what the expectations are. then you're going to be holding them accountable to that. So as students, and typically it's individual students who are not engaging, and it might be for a variety of reasons. They don't see value in it. Maybe it's they're stepping outside their comfort zone. Maybe they don't like their classmates and they don't want to engage. Whatever their reasoning is, it doesn't matter. You need to address with that person that it is an expectation that they become a part of this. But you also have to the student has to see value in this too, because if you don't tie back to them what they're getting from it, they don't have a reason to engage. If they can sit through class all day and watch other people do it and get the same thing out of it, then it's not going to be valuable to them. So tying these pieces back to your assessment of their learning, which would be your exams or whatever other activity, a paper, a presentation, whatever, tie it back to points. Somehow it's going to suddenly bring value to the students. It's sad to say that, but we know today's learner, it's not just about the learning, it's about what's going to be on the test. And so making sure that these activities are transitioning to assessment of their learning is in fact going to make that important to them. One of my friends, great friends, Susan Luperl, who's just an amazing educator. One of the things that she says to her classroom that I absolutely love is when students are not engaging, she'll just kind of sit back and she'll say to them, I'm going to take a poll of the class and I'm just really curious. By a show of hands here, how many of you would like to be a mediocre nurse? Raise your hands, just raise your hands, And of course, everybody chuckles and their hands stay down. And then she'll say, oh, that's interesting. So how many of you want to be an exceptional nurse? And of course, everybody's hands fly up. Well, what you're demonstrating to the students with that is you're saying, okay, if you're not participating in the care of these patients in the classroom, you're a mediocre nurse. If you want to be an exceptional nurse, you need to engage, you need to care for the patients that we have here today. And of course, there may be opportunities where you have to call out students. I don't say call out verbally in front of the class. Shoot them an email, ask them to come by your office, find out why they're choosing not to engage. Don't just assume that you know why, but follow up. There's some students who are like, you know what, I'm exhausted. I'm getting 2 hours of sleep a night because I'm caring for my mom and my kids and my husband or whatever. You need to find out what is causing that lack of participation, but handle that on an individual basis with those students.
It's a perfect segue into how can nurse educators really create that space for students, that psychologically safe learning environment so that they are comfortable taking risks and making mistakes in an active learning environment. Do you have any tips or anything that you've maybe implemented to create that safe space for students?
Well, again, I think letting the expectations be known to everybody, but also everybody is on equal playing field here with their ability to make mistakes. In that, one of the things that I do too, if students are not engaging, is I have resorted to what I call popsicle sticks, which means I've got everybody's name on a popsicle stick at the front of the class. And if I feel like people are not engaging, they're not answering my questions, they're not participating, I'll call out students one at a time on these popsicle sticks simply by drawing them out of a jar and ask that person to address the issue. So it keeps students engaged because they know they can be called out at any point in time. And it's fair because it's random. And of course, the popsicle stick does not go back into the jar. It's set to the side so that everybody has an opportunity to be called out at some point in time. And it's very uncomfortable, or can be uncomfortable for an individual student, but they need to recognize that everybody in that classroom is being treated the same. Everybody's getting called out. Therefore, it's not unfair to them. It's just uncomfortable for them. Now I'm rambling so much, Kelly, I've forgotten your original question. But
No. Creating that safe space for students so that they feel comfortable taking those risks and making mistakes, and they're not going to feel belittled or ridiculed, or there's no backlash, that educators are truly using those opportunities to grow the student, that we are creating a environment where they feel that support, that sense of belonging, that they can continue to grow, even though if they have a little misstep.
And, on the flip side of that, too, is that we can control our behavior and how we are treating the students that have those missteps. But we also have to be astutely aware of how their peers are treating them. And so recognizing that one student may be very intimidated and not speaking out because they're afraid of ridicule by their peers. And that's an entirely different civility issue that has to be addressed as the instructor, by the instructor, and within class. You have to nip that in the bud right away if you learn that those things are happening.
So what strategies have you seen that might work well for helping quieter or more introverted students actively participate? Because we see those students, they're hiding in the back of the classroom or they're just a little bit quieter. And again, you mentioned there may have some of those multidimensional variables that are impacting them, such as they're working 40 hours and they're taking care of, they're a sandwich generation, taking care of their parents and their children. And there's a lot of things going on. But how do you help that quieter, more introverted student participate?
Yeah, what I like to do is, again, have a one-on-one discussion with them and ask the student if I can do a follow-up privately, either before or after class, or ask them to come to office hours, find out exactly what the core of the problem is and why it is they're not participating. But that student also needs to recognize that as a nurse, it is expected that you're going to be a patient advocate. You are going to be outspoken with your team. You are going to have to stand up to doctors in many cases. That is a very uncomfortable situation. So you need to develop that person as an individual to feel the confidence in themselves in order to be more outspoken, because that's a nursing quality that they need to acquire. Just sitting and having someone be quiet and allowing them to not engage, I think, is doing that future nurse a disservice, because they can either deal with that discomfort now or deal with it when they're out in the profession. And as we know, out in the profession, it could have a negative patient ramification if that nurse is not outspoken. So again, we have to develop those soft skills within our students so that they become safer providers of care once they are out in the profession. And that might mean working one-on-one. It might mean maybe that student needs to spend some time with counseling services on how to develop their skills on being more outspoken and developing those communication skills and engagement skills.
I think of working with our arts and science department, as they're taking those communication classes and some of those English classes and speaking in public and such, being able to partner with our colleagues in that way, so that here's what is expected of our nursing graduates as they enter into the field and how they can help us grow that student throughout the curriculum.
Also on that, we need to be conscious of is that sometimes the introverted students, it's because of cultural differences as well. So being aware of that, and again, being in tune to that, but recognizing that if you're planning to be a nurse in the United States, this is one of the skill sets that you need to be developing.
Do you have any other thoughts on how active learning really supports the development of that clinical judgment and that real world decision making as they enter into practice?
What was it, 2017, 2018, when clinical judgment and NCSBN announced the clinical judgment measurement model? I fed into that big time. I totally drank the Kool-Aid on the whole concept of clinical judgment measurement model. But I decided to use that as a foundation in my active classroom and structured all of my activities around, that layer 3, those 6 steps, and recognizing so that our students could follow through in a sequential manner and caring for patients using the foundational theory of the clinical judgment measurement model. And as I was using that throughout the semester, I didn't have any proof that it was going exceptionally well until we got to the end of the semester. And what happened in the sim lab just totally amazed me. So I had a group of 5 students in the sim lab, and I'd had them throughout the semester, and they had been using the steps of the clinical judgment measurement model in all of our case studies and our unfolding cases and every activity we had, our SBAR case, everything, they've been using it. And the students were caring for this patient who was becoming compromised and starting to deteriorate, and were very frustrated with it, and would go to the phone and they'd call the doctor. And in my sim lab, the doctor never picks up the phone because the doctor typically gives students answers like what to do next. And I don't want that. I want students to decide what they need to do. So as they went to the phone and didn't get the answers they needed, a student came back to the group of 5 students. They're like, okay, guys, let's really think this through. Let's start at the very beginning. What cues do we recognize? And they started, and as a group, they worked through each of those 6 steps of the clinical judgment measurement model to come to a cohesive solution how to improve this patient outcome. And I was absolutely thrilled. I was in the sim control room and I was just doing the happy dance in there because I couldn't believe it. I was like, oh my gosh, this is really working. We're applying clinical judgment as a result of these active learning activities that we've had throughout the semester. And I watched that unfold. And I went from drinking Kool-Aid to drinking champagne. I was so thrilled with that outcome.
That's awesome. Well, and kudos to you to really mentor them through that process and then to be able to see it in that simulation. That had to be exciting for sure. So it sounds like that was a breakthrough moment thanks to that active learning. Do you have any other stories or any other kind of aha moments that you have seen educators using active learning strategies or students having that aha moment that I finally get it?
Yeah, I think that active learning can be more than just in the classroom, but active learning is something that a study method that you can share with your students. So I'm thinking of one example that I had quite a few years ago, and I had a student that was really struggling and just barely passing the class, and she was working hard. It was not that she wasn't putting in the work. She was just really struggling with the material. And so she came to my office and I said, well, let me see your notes. What do your notes look like? And she pulled them out and I could tell very quickly she was a visual learner. She had lots of colors and graphs and, she was very much visual. And so I sat down with her and I just taught her in just about 2 minutes on a rough draft of a concept map. I taught her concept mapping to use that as the structure of her learning process and how she could take the content material and apply this more actively through looking at how things are associated with each other by drawing out a concept map. And I tell you, on the very next test, her grades went from 74% to a 94%.
Oh, wow.
Just because she was looking at the material in a way that she learned best. And I think the beauty of active learning is that you have such a variety of different activities that you're meeting the learning needs of each individual diverse learner by giving them variety. Majority of students do not learn from staring at a PowerPoint and listening to somebody speak about the bullet points. It doesn't go into their deep learning. And so if we mix up how we're doing things, it can make all the difference. And you think of the difference of going from a failing grade to an A grade, how not only is that amazing and the student passes the class, but it might make the difference of a student passing the program, which would make a difference in the person becoming a nurse, which would make a difference in feeding their family. And it might make a difference in future generations where now I've got a mom who's educated, who's got a salary, who has been successful in nursing school. And so I think we underestimate the value of what we do as educators.
That ripple effect is so powerful.
It really is.
Yeah, that's amazing. So before we wrap up, we always like to ask whether or not you have one spark, something memorable that our listeners can carry with them into their teaching and their learning journey. So, Karin, I'm going to ask you, what's one spark or pearl of wisdom you'd like listeners to remember about our conversation today?
Well, I must be a little sparkless today, Kelly, because I'm coming up with the same spark that I used last time. But one of the things that has been my motto since the beginning of time with my active student learning is that students need to really be thinking hard in the classroom. They need to be working harder than you're working. And so when you have students whose brains hurt, that means they're using their brain power in a way in which they're thinking deeply. So my spark, my mantra that I've always used is the fact that when we get done with this class today, your brain should hurt. Because if your brain doesn't hurt, then I haven't done my job.
Karin, thank you so much for sharing your insights and your passions for student-centered learning and your perspectives. I think definitely reminds us that active learning isn't just about engagement, it's about transformation and supporting the student, making them feel that there's a sense of belonging and that it is a safe learning environment. So that's a wrap on our part 2 of our active learning series. Thanks for being part of the conversation and keep the momentum going. Teach boldly, learn with purpose, and spark positive change. Thanks again, Karin.
Thanks, Kelly.
Thank you for joining the Lippincott Spark Illuminating Nursing Education podcast. Enjoy this episode, subscribe, share, and leave us a 5-star review. For more information, click on the link below to learn more about Lippincott Nursing products and services. Until next time, keep leading, learning, and making a difference in nursing education.